This is Dr. Michael Persky. I'd like to talk to you about chin augmentation using chin implants. Both for men and women, chin implantation is one of the fastest growing facial plastic surgical treatments. We're seeing an increase in demand for this procedure, and many people think it may be because of social media and the preponderance of the digital age, seeing ourselves on video cams and the computer, FaceTime, Instagram, etc. It's a relatively simple procedure to have done. It's done through a small incision under the chin and a crease where most of us have had little traumas in the past. The scar, once it heals, is almost indetectable, and the procedure is done through that incision. Dissection is carried down to the actual mandible bone. A small pocket is made in the tight lining of the bone on either side, and the chin implant is then tucked into that pocket. The muscle is then closed, the soft tissue is closed, and the skin is closed. The stitches stay in place for 4 to 5 days, and once it heals, it's very difficult to even tell that there's anything in there, both from the patient's perspective as well as from other people's perspective. When patients come in for a chin implant consultation, we assess their anatomy. We have different sizes of chin implant sizers that are then placed over the area. The implant fits somewhat like this. Depending on how much projection the patient needs, the correct implant is selected. During surgery, the implant is placed along the inferior border of the mandible, and it sits kind of like this. And the most important thing when performing the surgery is to make sure that your surgeon dissects low on the mandible to avoid these little holes called foramen. They're the mental foramen where the mental nerve comes out, and if this is damaged, you can end up with some numbness. So it's very important for the surgeon to know their anatomy, obviously, as with any surgery, and to avoid that. Ideally, you want your chin to hit your lower lip. If a line was dropped straight from your lower lip to your chin tangentially, that's about the projection that you want. Another interesting aspect of augmentation implants in that area is a pre-jowl implant, which doesn't really have the projection for the chin, but it has projection out here for the jowl, and this in the pre-jowl. So what it does is it blends the jowl area with the chin and gives the patient a stronger chin line, chin line. So it sits there like this. It doesn't really give you projection, but it fills in the jowl area permanently. So both the chin implant and the pre-jowl implant are available. It's a relatively simple procedure. It takes probably about 30 minutes to do. It's usually done in the operating room. And certainly if you have any more questions about your chin or chin implants, please feel free to contact us. One of the really nice things about a chin implant is the bigger the chin is, the smaller the nose looks. Be well. Bye-bye.